Hello, I'm Dr Natasha Frawley. I'm a consultant obstetrician gynaecologist and an ultrasound sonographer as well. I live in Ballarat with my family and I like to do parkrun. I'm an obstetrician gynaecologist, so I do obstetrics and gynaecology at the hospital, including caesareans, gynaecology operations, and I've done ultrasound training at Royal Women's Hospital, so to obtain a diagnostic diploma of ultrasound. I'd like to talk to you a bit about some of the ultrasound services that I offer at Lake Imaging, and there's 4 main groups of ultrasound services that I offer. I have done extra training to get a diploma of diagnostic ultrasound, and I think one of the advantages of patients coming to me to get scans is that as I'm a doctor reporting the scan, I'm able to give the patient the information as I go, and when they leave they have an idea of what the report's going to say. So the 4 types of ultrasound that I offer is a dedicated obstetric ultrasound, which is for all ultrasounds during pregnancy, so including a dating scan, a morphology scan towards the end of the first trimester, the morphology scan in the middle of pregnancy, and then 3rd trimester fetal scans for growth and well-being. Then the second type of obstetric scan that I offer is twin pregnancy scans. And it's important in the twins to get to determine what type of twins they are at the start of pregnancy, and then I offer the twin anatomy scans as well as the twin wellbeing scans. In terms of gynaecology, I offer a dedicated gynaecology ultrasound. I've done training in ovarian tumour analysis, so called the aorta analysis group, and so I'm able to determine ovarian pathology and the risk of malignancy by ultrasound, as well as doing ultrasounds to evaluate for abnormal bleeding, and I also offer a pre-operative endometriosis ultrasound. And the final dedicated ultrasound scan that I provide is a teenage pelvic scan. I have an interest in adolescent gynaecology, and I think it's important in this group of patients that they have a comfortable experience with their ultrasound. Medical imaging is very important when it comes to early detection and prevention of disease in women's health. So for example, with the endometrium, which is the lining of the uterus, and that's where you get your periods each month, any disease there can be picked up pretty early on ultrasound, and so it would be important with any abnormal bleeding to get that checked out. Similarly with the ovaries, you can see a lot of detail on those scans. And for something like irregular periods, one of the common causes of that is something called polycystic ovaries, which requires an ultrasound, and if people are diagnosed with that, they can access early treatment, including hormones and lifestyle modifications, which can improve their health. So this week's Women's Health Week, and from Lake Imaging we obviously want to prioritise women's health, and my message for other women out there would be to take a moment for yourself, whether that's going for a walk around the lake or having a coffee with friends or prioritising a health check.